Welcome to your online course on neurodevelopmental disorders. As we begin, it is important for me to note that mental disorders are very common. They are so common that it is becoming increasingly important for all healthcare practitioners to familiarize themselves with common mental disorders. That is, if they must offer the necessary help that their patients require. So in this course, we shall work together to help you familiarize yourself with the common mental disorders of our times. I will be your teacher, Dr. Amelia Kenya. Our main reference for this course will be the American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, commonly known as DSM. We are in the 5th edition of this book. DSM-5 is our official reference that gives us the classification of mental disorders. Why is it necessary for us to use DSM-5? It is important because DSM-5 has very valuable information for all mental health workers. It has valuable information for psychiatrists, for the physicians, for the psychologists, the social workers, the counselors, even those who work within the forensic and the legal specialist departments. It also has important information for those working with occupational and rehabilitation. It has important information for basically healthcare professionals. And for you who is listening today, you fall right there in the group of physicians. DSM-5 is also our official tool that we shall use for collecting and communicating accurate information to the public. This is where we get our statistics on mental disorders, whether it relates to the morbidity or the mortality that occur with these mental disorders. It is also important to realize that DSM-5 at the moment is not working on its own, basically by the American Psychiatric Association. The classification of disorders has been harmonized with the World Health Organization's International Classification of Diseases, commonly referred to as ICD. This is the official coding system that is used in the DSM-5. This is where we get our diagnostic names and the code numbers you will use as you deal with your patients. DSM-5 has both ICD-9 codes and ICD-10 codes. These were adopted way back in October of 2014. ICD-11 codes were scheduled to be released in 2015 in the United States, but as per now, we are still using the ICD-10 codes. As we get into this course, let us define some terms so that we are all on the same page. We are looking at mental disorders. So what is a mental disorder? We can classify or define a mental disorder as a syndrome. What do we mean exactly when we talk about a syndrome? Anytime you hear reference to the word syndrome, we will be referring to a group of symptoms that consistently occur together. So this is a combination of symptoms that will not separate easily from each other. These syndromes are characterized by the clinical significance or the disturbance that they cause in the individual. So you'll begin to analyze a patient and recognize that a patient has a mental disorder when you find their cognition function is impaired. You can look at their emotions and even their behavior, and you find also that they don't meet the exact qualifications you would put in what we would call the normal brackets. As I use that word, I am using it in quotes. Somebody who has a mental disorder will show very clear dysfunction when it comes to their psychological, their biological, and even their developmental processes. Mental disorders are usually associated with very significant distress. They will show themselves in the way we relate socially. They will also appear even in our occupation. And because they are associated with high levels of stress, it is important also here to note that handling stress positively will help alleviate mental disorders. How? Take time and exercise. Rest. And you find you are dealing with situations that are beyond your control, take time also and talk to somebody.